This broadcast is brought to you by Colby Brooks with Century 21 Right Pace Real Estate and buyfrombrooks.com. Let Colby Brooks handle all of your real estate needs.
Now, Stan Morris reporting.
Great to see you this afternoon on NEA Report. Stan Morris reporting in Jonesboro. It's the beginning of May 1st, 2020, and maybe the beginning of some better news, too. We're talking about COVID-19 today, but we're talking about it on a much different tone than we have previously. The reason for that is that according to the Arkansas governor and the Secretary of Health, Dr. Nate Smith, the active cases have dropped massively today. A single-day drop that's unlike any we've seen before, but that's because of a categorization change. It doesn't mean that they're perhaps less accurate now. It's indicative that there was an issue with the accuracy before, as the numbers were hovering around 1,800. But the Secretary of Health saying today that a lot of those people had already been released from the hospital. They had had trouble contacting them and getting in touch with them, and so there was an issue actually following up with them, and that has changed in the categorization method to hopefully allow for more accuracy. And if they can't follow up with someone, but they know they've gotten better and got out of the hospital, then they may be able to mark them as recovered. So that means, as of the current numbers, Arkansas is at 1,284 still active cases, with 3,321 cases to date. Of course, that means cumulative. There were 64 deaths reported today. That's a little bit of an increase over where it was the previous day. I believe one of those was also a nursing home. And we don't know the exact number of tests administered at this moment. That'll be updated later today by the Arkansas Department of Health, but it's over 48,000, at least over 47,937, because that was the last update. Of course, they could always, I suppose, reduce that down. Some major announcements today, and we know a lot of folks were really happy about this one. Salons, spas, tattoo shops, guess what? You're going to be reopening next week. And we know a lot of folks out there are extremely happy about this. Your livelihoods, your businesses have been severely impacted by this. Well, the good news is maybe at least a little relief. Now, it's not going to be full-on business as usual. There are going to be a number of restrictions, and I want to tell you about those because I want people to know this stuff and hopefully follow the guidelines too. If we just dive right into this head first, we may end up making a mistake, but if we slowly readapt to life, if there are decisions or adjustments that need to be made, it allows for those to be made more easily. That being said, reopening of barber, cosmetology, massage therapy, body art, and medical spa services will be, with a few exceptions, 10 or fewer people in the facility. Larger facilities, no more than 30% of the stations in operation, right? For smaller facilities, perhaps it's a little bit different, but you still have to have a 6-foot distance between clients during appointments in the walk-in area and the wait area. Also, clients that are waiting should wait outside or in their cars. Time needs to be set between appointments for cleaning, and with that in mind, and this is going to be an adjustment for some locations that have built their business around doing the exact opposite, there are no walk-in appointments that are supposed to be conducted. In other words, we should be calling ahead to make appointments, at least until we get out of this phase, so that we can make sure, number one, they're not overcrowded, number two, they have enough space for everybody, and as you could guess, with this reopening now, it's probably going to be packed. Vulnerable populations should consider staying home according to the guidelines. Probably not a bad idea. So let's talk about some more changes that are on the way, because we know a lot of folks would like to get out of the doom and gloom, and we're ready to as well. The gyms and fitness centers, we learned yesterday, will be reopening on Monday. Of course, numerous restrictions apply. For example, they're supposed to be screening staff and patrons for temperature to make sure nobody's coming in with fever, and also nobody should be in there who's been symptomatic or in recent contact with a COVID-19 patient or traveling to New York, New Jersey, Connecticut, New Orleans. Anyone with a compromised immune system or chronic disease, in other words, those at-risk people, should still consider staying at home based on this advice. But temperature checks for staff, it says. It doesn't say for patrons, it just says screenings for staff and patrons. So I may have misspoken on that. But it may also be wise for locations to be doing that, right? To if they have the forehead scanner like the city of Jonesboro uses at the city hall, for example, when you come in. Face coverings for staff and patrons, except when actively exercising. I kind of made a note about that on yesterday's show. I would suggest you go back and look at it. It might not be a bad idea to wear it while exercising. There's actual fitness reasons for that. We'll talk about that on the show yesterday, though, if you want to go back and watch it. We've covered it enough for our viewers here. No pools, spas, showers, or saunas. Hand sanitizer has to be available. Equipment sanitized after each use, 12-foot distancing while working out and during training sessions and classes, and no personal contact. Some more stuff to tell you about. We know restaurant owners were happy to learn about this. On May 11th, limited dine-in service gets to begin again. Does that even make sense in English? Starts again. How about that? Begins again. Resumes. That's the word we're looking for. But there's, again, many restrictions. Face coverings. You got to have physical distancing between patrons and tables, it says. So you can't have everybody crowded in there. Once again, they need to keep the restaurant's limit to about 1/3 according to these guidelines, and strict social distancing guidelines are supposed to be enforced. For example, no bars, no entertainment within restaurants, such as like the stage with concerts, loud music, for example, or whatever it would be. You can't do that just yet because they can't have so many people crowding around. At the same time, they're also encouraging reservations because they don't want the places to be packed. They're saying no groups over 10 people, senior hours encouraged, no self-service, so the buffets are going to be an issue there, and to clean, disinfect tables, menus too. That's important. Probably not a lot of people thinking about that one. And of course, gloves for staff, gloves that they should be changing out regularly, right? And not just once a day. Parks are going to reopen for in-state resident RV usage today. So perhaps some people going out and enjoying the beautiful weather. It's been actually gorgeous outside for several days now. So I hope that everybody's getting to enjoy that a little bit. On May 15th, restaurants at parks reopen. That's what that means. Don't get that confused with restaurants to begin limited dine-in service starting on May 11th. This is in relation to the parks where they're, for example, gift shops and stores, as museums or other trade shops that might be located there. Those locations will resume on May 15th. Of course, there's still going to be a lot of restrictions that apply to that. Dental procedures are going to resume on May 18th, the governor said, I believe it was last Friday when he announced that. Another announcement that a lot of folks in Jonesboro will be interested to hear, the curfew's over with tonight. The mayor made that decision this week. It had previously been from 10 p.m. to 6 a.m., but no more. No, the mayor making the decision that the curfew was something that we could lift. Of course, it's been loosely enforced, and those who have complained about their civil liberties on that one probably, truthfully, have never even been stopped by the law. But if you have and you have a story, you want to tell us about it, we'd love to hear about it. And I do respect a lot of folks for saying, hey, look, we need to be careful about what we do with restrictions and the such, and we get that. But at the same time, the Jonesboro mayor making some tough decisions, and based on the advice of people a lot more expertise in medicine than he or I or any of us, unless you're a doctor in chat, right? An epidemiologist or some type of disease specialist. The mayor making that decision this week. Of course, everybody that is making these decisions to whether it's relax social distancing a little bit or to reopen certain locations, they're also making it with a note that if things get bad, we can still change and go back. That's why we're not making a full reopen and a full adjustment. It's basically we're turning around and going slowly back in the direction of life as usual and seeing how that's going to affect us. But the big headline, besides the fact that salons, spas, tattoo shops, and others will get to reopen next week, is that the active cases today, 1,284, a number that we're very happy to see continue to go down. Thanks for joining us on NEA Report. You're up to date. More news from Northeast Arkansas later in the day. In fact, I guarantee you'll want to keep it tuned here because we've got a major story getting ready to break on NEAReport.com you won't want to miss. I'm Stan Morris reporting in Jonesboro, and you're up to date from NEA Report. Take